Hi, I'm Dr. Siddharth. A lot of patients have been coming to us with pain in front of the ear, in the cheek area, behind the ear, in the neck area, and the side of the face. They have been going to ENT surgeons, migraine specialists, neurologists, trying to figure out the cause of the pain. Sometimes it is as simple as the muscles of mastication. Now, there are four big groups of muscles of mastication. Of that, the one which is of concern here are the lateral pterygoid, which is a small muscle as big as the fingernail. It is located just in front of the ear. And you have the masseter muscle, which is a big belt-like muscle on the side of the face. Now, this muscle helps in clenching of the jaw. Now, we will learn how to palpate this muscle, and once the muscle or the knot is identified, on how to relieve the pain. Yeah. So, for the demonstration today, Ripa has volunteered. Okay. So, basically we will be checking the masseter muscle and the lateral pterygoid, which are the two most important muscles which cause pain. Now, the masseter muscle runs on the side of the face here. So, when the patient opens the mouth and clenches, the masseter muscle tightens, and you can feel it on the side of your cheek. Yeah. The lateral pterygoid open. When the patient opens the mouth, the lateral pterygoid is a very small muscle inside. It becomes tight. Close. When she closes the mouth, the lateral pterygoid will sag, and when the lateral pterygoid sags, that's the time you will be feeling the lateral pterygoid. Okay. So now coming to the masseter muscle. The masseter muscle usually gives pain in 3 points here: an upper point, a middle point, and a lower point. So what you do is you gently feel, first bite hard, and then you feel the 3 points. If there is pain, you will get to know that that muscle is tender. So when you have pain, apply slight circular motion and massage that area, or you can apply pressure and let go. And this has to be done 3 times in a day, and every time you do 3 cycles or 3 repetitions of it. Next, to check the masseter muscle from inside, what you do is, like you hold a pen, you will hold the masseter muscle and feel. So how you do that is, open the masseter muscle, with your thumb you feel the inner part of the jaw, and with your finger you feel the outer part. So basically what you're doing is you're pinching in between. So you pinch the masseter muscle, and then you feel on the top, middle, and lower. Yeah. If you have tenderness, again you can massage the muscle in circular motion. Yeah. The next muscle, which is a more common cause of the pain, is the lateral pterygoid. So the lateral pterygoid is a little difficult to isolate and apply pressure on. First, you need to feel the cheekbone. Okay. So the cheekbone usually is next to the first molar. So once you feel the cheekbone from outside, you feel the cheekbone from the inner aspect. Behind the cheekbone, there is a depression. So once you feel the cheekbone, you go behind the depression, and then you ask the patient to bite hard. Now when the patient bites hard, the muscle which was tight will sag and come into your finger, and you will generally feel pain now. So if you feel pain now, that means your lateral pterygoid is tender and sore. So what you have to do is something called as isometric pressure method. So you apply pressure and wait for some time till you can bear it no more, and then you let go. Again you apply pressure. Remember, when you're applying pressure, you're biting hard. That's when the muscle sags. So you find the bone, you go behind, apply pressure and let go. Apply pressure and let go. This again has to be done 3 times in a day and 3 cycles every time. Okay. So started. Okay. So there are a few precautions that you must follow as the muscles are healing. The massage is to be continued for 1 month at least, and these precautions also for a period of 1 month. The first instruction is not to open your mouth too wide, especially when you're yawning, having a burger or having some fruits. Don't open and stretch your muscle by opening too wide, because then that area gets injured and healing gets delayed. The second thing which you should follow is not to move your jaw right or left, because by doing this right or left movement, you're again straining the muscles of the jaw. The third thing is to avoid all chewy food. Chewy food is like naan, rotis. because the more repetitions you take in breaking down the food particle, the more strained the muscle will be. These precautions, and obviously the other thing is, try not to eat on one side, eat bilaterally, because again if you're eating on one side, the muscle gets sore. So eat on both the sides and soft food. Yeah, if you follow these precautions, then the muscles should slowly relax down.